Hello friends, I am Dr. Rehan Sabir Momin. I am a consultant general surgeon and have brought greetings from Maven Medical Center located in Hyderabad. Today we are going to talk about a very common procedure which is done day in and out in every surgical clinic, that is called circumcision. Circumcision is the cutting of the foreskin of the penis. It is defined as a procedure done by the surgeon and removes the skin which is covering the tip of the penis. What are the indications? So what is the reason why the people get their children circumcised? Well, the very first is mostly in pediatric age group. Most of the time there is infection there at the foreskin of the penis. We call it as a phimosis, because of which the children are unable to retract the foreskin. So when they pass the urine, there is a ballooning of this foreskin, and it's very difficult for the child to pass the urine normally. So this is a condition where they require the circumcision, removal of this foreskin by surgical procedure. Second is the paraphimosis. Paraphimosis is nothing but it's a constriction of the tight ring below the glans of the penis because of this foreskin, in which we have to act and do the circumcision as early as possible. Otherwise, that will impair the blood supply of the glands. And third is the circumcision based on the religious belief, which is very common custom in Muslims as well as in Jews. And there are other indications, in adult group, but today we will be talking only about the children. And what are the other benefits of doing the circumcision done? Where it reduces the risk of repeated urinary tract infections. And second is when the child grows up, it reduces the risk of penile cancers. And third, when the child grows up and becomes an adult, also it reduces the risk of getting sexually transmitted diseases. And what are the different methods? Because we hear day in and out, there are different methods which have come. Earlier, the children used to get the parents used to get the children circumcised by going to the barbers, and they used to just bluntly just cut the skin brutally. But it has been done in a very proper surgical, like any other operation in an operation theatre with all the aseptic precautions. So normally there are two methods which are commonly seen. One is an open method, which is a recommended method, and the other is a clamp method, which is not recommended. In open method, the glands actually should be exposed at the time of cutting the preputial skin, which is a very safe method, and it gives a very good result cosmetically. So sleeve technique and the dorsal slit technique, these are the ideal preferred open methods. Whereas there are many devices which have come in the market, and which are all clamp methods, where the glans is not visible to the surgeon while he cuts the skin. So there are many clamps named as Prepex ring and Unicirc device, staplers, plastibell rings. But the Indian Association of the Pediatric Surgery does not recommend clamp methods for circumcision, because glans is not visible completely during the procedure of circumcision, and there is a high risk of injuring the glans, causing it necrosis. Now, what anesthesia has been used? Do we need any anesthesia? Yes, of course we need anesthesia for the proper cooperation from the child. If the child comes in the age group less than 3 months, then we give just local anesthesia, a local injection at the root of the penis. If the child comes with the age group between 3 months to 12 months, then we need to give some sedation in the operation theatre where the child sleeps off. And if the child is more than 12 months of age, like 1 year or more than 1 year, then we need to give a proper general anesthesia in the operation theatre where we need an anesthetist. Do we need any investigation is a very common question that has been asked by the parents. Yes, we need a very basic investigation like CBC count, that's a complete blood count. It can show your hemoglobin of the baby as well as WBC, or if there is any changes significantly. And second is BTCT, that is called as a bleeding time and clotting time. And if the baby had any episode of jaundice or something like that while he was being delivered in the hospital, then we need to have a liver function test just to rule out that the baby is out of jaundice. That's an option. And normally it takes 7 to 10 days for the wound to heal completely. And there are some contraindications where the circumcision shouldn't be done in the babies also. One is a meatal stenosis. One condition is a meatal stenosis, where the opening of the urethra from where the urine comes out, it's like a pinpoint. So in these conditions, if we find a penis with a pinpoint urethra, we should not operate. We should have to refer it to a plastic surgeon or a pediatric surgeon who will do a meatoplasty. They will use the same foreskin and they will do a proper repair of it. Second is a hypospadiasis, where the urethral opening is not present in its normal position. It is adjacently front or back, it will be present. So even this requires a stage procedure done by usually plastic surgeon or the pediatric surgeons. And what precaution are we supposed to take while doing a circumcision? See, normally what we see that if the baby is low birth weight, like if the weight of the baby is less than 2.5 kgs, or a preterm baby, then we advise the parents to come after 3 months and then get the circumcision done. And if the baby had a jaundice or baby has a jaundice, then we ask, there's a physiological jaundice, then we ask the parents to wait for at least 3 weeks and then come and get the circumcision done. And there are, circumcision is very, very common and very minor procedure, but there are some complications like a hematoma, necrosis of the glands of the penis, trauma to the glands. So if we do it in the proper way in operation theatre with the proper technique, then we can avoid all these complications. So if you know any baby or any child which requires this procedure, then please contact at Maven Medical Center and avail our services. Thank you so much.
Maven Medical Center, Road number 2, Banjara Hills, Hyderabad. Call 8121 200 400.